Live, everyone. Hey guys, we're live today. We're going to be discussing the scourge of the back. The scourge of the back for myself. I'm a practicing chiropractor, practicing out here in El Paso, Texas. We usually have a disorder that typically there isn't a day that we don't see it, and it affects so many people. But there's a lot of confusion with it. I call it the scourge of the low back. It's called sciatica. Sciatica is a disorder that has many reasons and many causes. One of the most important things is to first assess the reason and the cause that you have sciatica. But most importantly, when it first hits an individual, it strikes them usually with a shocking misunderstanding as to what's going on in their legs. They feel pain in the low back. They sometimes feel pain in the leg. There are different areas depending on where the issue lies. So a little bit of the anatomy breakdown of it and the explanation of what it is. First of all, it's a syndrome. It's a syndrome that has many reasons and many causes. The issues that come about and that make sciatica arise are vast. I would venture to say that there's 1 million people that come in with sciatica. Literally, there's 1 million reasons that have presented on each one of those patients. There's a majority of problems and a subset of issues, but we're going to go over that. And our goal today is to kind of bring out the awareness that first of all, it is a problem, just like anemia, that it presents. And there are many reasons why a person would have anemia. A lot of people are familiar with anemia and they say it's low blood, but you got to find out where the blood issue is in order to determine exactly what the cause is of anemia. Well, the same thing with sciatica. There's a lot of reasons why the sciatic presentation occurs. So we're here to kind of begin the process of explaining that. So we're going to get real deep and down and nasty with the science of it. We're going to try to give you some tools that you can look at and to assess so your provider can kind of give you a better explanation, or you can ask better questions in terms of where your sciatica originates from. So the first thing is to understand the anatomy, and I'll go through the anatomy in a very visual way. But I want to first kind of take you to a visual, and my visuals are very three-dimensional and offered through Complete Anatomy. Complete Anatomy has given us the ability to use this and show, and it is something that a lot of medical students use. So in today's modern day, we don't have to use some visceral or some sort of human anatomy. We can actually use these tools to help us present to the patients and to teach. So it's probably one of the most used anatomical structured systems, and we actually use it to teach people and our patients in every day, given the dynamics of a sciatica. Here we have a picture of a sciatica HDMI. So when we can see it, we can see a presentation of what the sciatica nerve looks like. The interesting dynamics here is that when you look at the interesting presentation of it, you can actually see, as I go away, how vast and how large it is. Now, the first thing is I rotate this individual, you got to see that it comes from a large gluteal plexus in the lumbar spine all the way to the sacral nerve roots. So anywhere down the line that there's anything touching this thing, this beautiful, powerful nerve, you're going to find that there is pain radiating down. So we're going to discuss those issues, and as we kind of go over that, we want to be able to understand that. So away from HDMI, so what we're looking at is the issues that present with us when we discuss it. So what are the causes, and what is sciatica? Sciatica is inflammation of the sciatic nerve. And as it presents, what happens many times, it's the largest nerve in the body, and that's how most people know it, and it travels from the lumbar plexus all the way to the leg. So anywhere that thing is touched, it's going to radiate pain. Now, what are the causes? Well, they could be from vascular, they could be from compressive, they could be from lymphatic. There could be a space-occupying lesion, such as a tumor, causing the issues. Now, a good clinician will do a lot of different tests and a lot of different assessments in order to determine where it is having the problem. So when I have a patient, they come in, the first thing is we have to do is a history. We have to assess and we have to find out what's going on. So finding the history of something that all of a sudden someone starts sitting or they become active or they get hit in the back and they start having sciatica, it really bodes to a well dynamics. Picture on me this way. So what happens is what we need to do is we need to discuss the dynamics of where it begins and what goes on. So in terms of our direction, I would like to first take you to the physical assessment. When you explain to your doctor what's going on, you need to tell him exactly when you started having it. That's very important. The history is very, like, when are these issues? Do you have a sedentary life? So these are the types of issues that present. Most of the time, a person comes into the office with having a severe presentation that they're really shocked. They didn't expect this. And what occurs is HDMI. So what occurs in this particular area is that you can actually see where the nerve root comes in. So over here, you got to figure out where it came from. Now, as you notice, a lot of the reasons that a lot of these individuals have it is because it's a little bit of atrophy and muscular issues that arise. As you can see right here, there's a lot of areas where the nerve can become entrapped. This is the main reason that most people have this issue. Now, as they go through this and they present a symptom, I got to figure out, and along with our team, we have to figure out where the problem actually originate from. So as I go through that, I want to also give you a different dynamics here. In what I'm going to explain, I'm going to present my team to you so that they're all going to, each one of them is going to explain a little different aspect of what goes on. Now, today we're going to be discussing how a coach, such as an individual helping the doctor, can assess the situation. We are going to talk to our coach, Kenna. We're going to talk to Astrid, who's going to bring some science knowledge here. And we're going to actually bring a patient in and discuss exactly what the experience was with her, and also bring in our top guy from the university at the biochemical level. He's going to teach us a little bit about some nutraceuticals and some applicational processes that we can do to help an individual with sciatica. So I'd first like to tell, I'd like to ask a question to Kenna. So Kenna, what I want to do is I want to ask you exactly what it is that you notice when a patient presents with sciatica, and what kind of things we can do in the office, and what's our approach specifically more like the metabolic issues and the disorders that present that way. So when we're looking at here, let me go ahead and head into this area. And there we go. And we are in here. And go ahead and tell me a little bit about how we present a patient and what we deal with when we're talking to an assessment or doing an assessment.
So one thing that a lot of patients with sciatica have is the pain that they're feeling, of course, in that low back. But another thing is they don't have a lot of movement due to that pain. And movement is really so important. It's really what life revolves around. So we take that movement and we look at how we can help this patient not only decompress that sciatic nerve with the adjustments that Dr. J does, but also how can I help from my side of things for this patient. So we do have a lot of great resources available to us. We send our patients to Push, which is a gym here that really helps them get that calibration in their deep muscles that they need to build up those stronger muscles also all around that sciatic nerve, so that this nerve doesn't get pinched as frequently or as often. And another thing we have available to us is an app called Dr. J Today. And what that app does is it syncs with the bracelet that our patients wear, which allows us to track their movement. So we really, really want to focus on that movement as part of it. And another thing we can do is nutraceuticals and supplements. So with those nutraceuticals and supplements, one of the main ones we focus on that almost every individual should be taking is vitamin D3, and we like it coupled with vitamin K. So this is really going to help your bones and your circulation, and it's going to help to decrease that glucose by increasing your insulin sensitivity. And this is where it really comes into play with sciatica.
I got a question for you. In terms of that, when you're discussing that, we're dealing with and sciatica as a pain in the hips. So
Correct.
We're correlating and we're tying together, I guess, a disorder that a lot of people have is metabolic syndrome. And many times they're overweight, and that was one of the presentations that many of the patients that have sciatica, not that everyone's overweight that has sciatica, but a lot of people that become sedentary and they don't move as much do suffer from metabolic syndrome. So in order to get that under order, one of the things is to bring the insulin under control. And once we do that, we start losing weight and we start getting more active with the exercise protocols. She mentioned Push because we start calibrating the hips. Now, as you can tell from our picture here, there's a whole lot of muscles in this region, okay? So as I kind of use the application, you can actually see a little bit more of the muscle tissue that is involved. So as we look at the muscle tissue, we can actually see that by calibrating, and these muscles that control the hip actually propel the creature, so propel humans, so to speak, right? So what happens is, as this happens, if this becomes deconditioned through a sedentary lifestyle, well, the thing that's lying underneath also stops working, and the muscles stop working as effectively. So one of the ways that we treat people is through a coach to assess their body mechanics and put them through the push fitness protocols that can actually help them to get a calibration of the structures. Now, one of the things that we do also in this process is we look at the sitting issues. And tell me a little bit about what you do, Kenna, in terms of helping people with adjust their lifestyle or modifying their mobility issues.
So with their mobility, like I said, we use that app, and we also use Push Fitness. And the supplements really, really have a lot that come into play because, like I said, with that increasing the insulin sensitivity, what we're going to want to do with that is it's going to help to control the blood sugars. And you might not necessarily relate blood sugars to sciatica just yet, but like I said, everything is connected. So when we put our patients on a protocol and we have them controlling these blood sugars, it also helps control their inflammation, because that inflammation is caused by sugars and chemicals in the blood. And that's also what's going to then cause nerve damage to our body and our system. And then once we have that nerve damage going, we're going to see a lot more patients sitting down, which then relates to that lack of motion. And then we see a lot of patients coming in with sciatica.
Sciatica. So basically, we're going back to the same monster, which is called inflammation. Okay.
Right.
So inflammation is the deal. People that have sciatica will often tell a story of how it kind of looms with them. It's kind of like having this untrustworthy nerve back there that if they have stresses or or they go through emotional dynamics, it actually affects sciatica. So this threshold that activates the sciatica presentation could have even an emotional component to it. So we want to bring that up to light too as well, because a lot of people, they have normal lives, but under normal situations, they don't have the presentation. All of a sudden, suddenly, bam, they get an emotional, financial issues, family things, and all of a sudden the sciatica just flares. Where is that even logical, right? The key is inflammation, inflammatory response, stress responses, and those issues do create a almost like a perfect storm to create a predisposition for inflammation. So that's why we bring in the dietary components and the food so that we can start also eating better to prevent inflammation. Again, those are one of the things. So she also mentioned the issue of Push. Push is our fitness center where we actually put people through exercise protocols. And when we start putting people through exercise protocols, it's there to calibrate. Now, what's the biggest muscle in the body? Well, not too far from the anatomy to anatomical structure. You can actually see here that in this particular area, you can see the muscles, and everybody knows that the glutes are the big muscles. So when you see this powerful muscle, if this muscle becomes decalibrated from a sedentary lifestyle, you're going to notice that you're going to have a lot of predisposition. So it's like a car with flat tires, right? So if the car with flat tires, it starts swaying and moving to the wrong side. Well, if it's swaying, you can imagine that it affects the axis and the axles and all that kind of stuff starts happening. Things like these happen, but in our human structure, there's a finely calibrated system here. Now, one of the things that a lot of people don't know and they don't think about is the lymphatic structure. Now, if you can see here, you can see the lymphatic. Now, those guys actually, it rides directly next to the venous structure as well as the arterial structure. And you can see it here. So as you can see that progressing, you also look at the arteries. So if someone doesn't have an arterial system that is working well and they're sitting on this, you can actually see congestion occurring around the structures around the nerves. Now, there's a lot of nerves in here. So when you start looking at this dynamics, you start seeing that a person who is not using their muscles actually has an increased level of congestion. So as I remove these muscles here, you can see this picture, and I'm going to remove every one of them. You start seeing the noticeable dynamics of how complex the nervous system is. So over here, you can actually see the complexity of how those nerves function. It's amazing to see all the structures in here. So when you look at this, you can actually see the amount of influence that lack of movement would actually cause. It's almost like a traffic jam. Imagine sitting on this thing all day long, okay? Let alone be inactive. So one of the things we want to do is we want to be able to assess exactly what it is. And one of the things that we do is to calibrate the system. So going back to removing these areas, we want to go ahead and we want to work on the big leg systems, okay? Well, the muscles. As you can see, these muscles bring a huge component into helping sciatica. Now, where are the sciatic issues coming from? Now, let's go ahead and let's start discussing those particular issues as we can kind of go through this. And I want to take you through a little anatomy lesson here, because it does require a little bit. As I remove these things, we're going to see all of the structures that actually come in, and actually, but you can, I'm going to see if I can get the nervous system only out to the minimal component of it, the big ones. And as you can see here, you can actually look over this way, and as you can see anywhere down the line, right here by where the nerves come out, where the disc comes out in this particular area, as it penetrates forward, it goes to what we call the sacral notch, which is this guy right here. This hole right here is a sacral notch where it comes out, and you can see that it can be bumped into from the ischial bone and the femur here. So there's a lot of areas that we can see that affect directly the sciatica regions. But having gone through that, I'm going to go into that a little bit deeper, but I want to go ahead and get a little personal story right now. I want to ask an individual, now, what sits in here? And most women, you know, this is where they contain babies, right? So in a situation where you have an individual that is going through a lot of changes, such as an individual who's having a child, you can see where the hips actually change. And right down there, if you can see down there, this is where the sacrum has to open up to allow for the birthing canal. You see that big hole right there? A baby's got to go through there. And if it can't go through there, which it probably won't until probably the ninth month, where actually this area starts expanding, guess who's going to go by there and kick it on the way down? Okay, that would be a child. Okay, so let's talk to that. And I'd like to present Trudy here, because she actually has a story of how it have actually affected her.
Well, I guess that, you know, as a woman, you know, it's a extremely joyful situation when you find out that you're going to be a mom. If it's your first time baby, you're in for a roller coaster. You know, like you guys were mentioning, there's a lot of different scenarios that you go through emotionally, physically. So when you're pregnant, you're the perfect storm for something like this to come up. You know, you are being disbalanced you're so tired the first trimester. I've always worked out. So for me I have never experienced sciatic pain before. And for me being so active, I went from being 100% active to just being so tired. I had to be super careful as far as how would I spend my energy, especially the first trimester. So on top of that, if you add, you know, everything else that's going on physiologically with me, and then my life became so sedentary. On top of that, you know, I have a desk job. So being sitting at a desk and then not compensating, moving, all of a sudden, that pain is so excruciating. I did not experience this with my first baby. I experienced this with my second child. And of course, I gained more weight with my second child. So once again, you know, you're adding problem over problem. And just because you're pregnant, that doesn't mean you're eating for two, because unfortunately, some of us, you know, have that misconception. And that's when your weight kind of tends to get a little bit out of control. So you're adding a lot of different factors that creates the perfect storm, and is just super hard. One of the things that Kenna was mentioning that helped me was becoming active. Being able to be exposed to push. I had someone here that was able to work out, specifically with me being pregnant. Obviously, my limitations as you start gaining more weight, it's not the same thing that you can do when you're not having a baby. So I was able to continue to work out later on. And, you know, after I kind of was exposed to chiropractic and being able to implement having exercise.
So the main symptoms that you had when you had sciatica and you were pregnant, was it mainly just pain, or did you also get that tingling feeling? Because there is more than one symptom of sciatica.
No, actually, unfortunately, it was just not pain. It was pain. It was burning all down my leg. Mm-hmm. I did not know what was going on. Like I said, this was not with my first pregnancy, and every pregnancy is different. With my first child, I watched more what I ate. I was still active. So I believe it was a combination of things, you know, that I literally felt like I was eating for two. I gained more weight than I should have.
I got a question. Was it when you gained the weight really rapidly during the final trimester?
I think everything kind of started happening a little at a time. And the first trimester, I wasn't that active. So I started having flare-ups, not as bad as once I gained the weight. But, you know, once I gained more weight, that's when I started having more severe symptoms. Like I said, the burning, the lower pain, it was just excruciating. It's something that I don't wish upon my worst enemy.
Now, did you ever have a recurrence after you had your baby?
Yes, I did. I did. Unfortunately, I did. But one of the things that has helped me keep that under control, it's been being active, continue to watch my weight, obviously my supplements. And that's one thing that I was going to ask Coach or Dr. Jimenez. When you're pregnant, I know we were talking about the different supplements. What do you still recommend for pregnant women to get on the different vitamin D, the K supplements?
That's a very good question, and one that I'll answer very clearly. As a wise disclaimer, you need to make sure that your doctor knows exactly what you're experiencing. Obstetricians, which are OBGYN doctors, they're very well astute as to what type of supplements. So in the world of supplementation, it is wise to have a doctor assess that, and many of them are going to go with making sure that you have good supplementation. The area where the true assessment is you have to have supplementation. Your body is trying to produce an enormous amount of cellular activity. As it creates life, it draws upon certain areas. The inflammation goes crazy. The body goes into dynamic changes. So nutrition becomes a very important thing, from intestinal nutrition through metabolic nutrition. So one of the things is that you have to have a doctor. Typically, today's individual who is in their as young childbearing age, they have a doctor evaluating. So yes, one of the most important things is from folic acids to vitamin E, Ds, a full complete gamut of vitamins that are assessed and given by their doctors. So most women will know that if they are taking some medication, they have to put clearly by their doctor. That's the most important thing. And the second thing is on the supplementation side, once your doctor knows, he's probably going to give you something of a basic level of supplementation and also nutritional assessment. So in terms of that, a person, a dietitian can evaluate you and assess you and actually determine what's going on. In terms of the aggressive approaches, where an individual is not pregnant, there's a lot of things that can be done. But let me ask you this. I know that you do a little bit of a CrossFit, and you do that kind of stuff. And you mentioned that you had sciatica after. I want to go to the point that a lot of people who have sciatica lead a predisposed life to sciatica. Now, meaning that once you get it, it's not that you're terminal, is that you always have the potential of having it. So whether your body dynamics has changed, typically you're not 18 and now you're 40, what happens is your body is warning you that it's not working like it should be, and all of a sudden the nerve starts becoming flared up, either through compression, through atrophy of muscle, through imbalance of muscles. So all those things are important. I noticed that you mentioned something that you did, it also affected you after. Did you do some competitions after, and did it affect you?
I did do competitions after. What had helped me keep it under control was, it's different factors to keep it under control. The keeping moving, the making sure that you're taking the right supplements, and chiropractic care. I'm a firm believer, of holistic approach. And I believe that a combination of all, it has helped me keep it under control. I have not had flare-ups, but I believe it's because I've had all these different combinations. Like I said, I kept active. I have, been in a normal weight. I have also implemented chiropractic, as a maintenance.
As a matter of fact, I would like to give people a kind of insight as to what happens when you actually first go to a doctor and they actually assess you. There's many ways to figure it out. One of the ways that's it's an easy way, if there's degenerative and there's bone changes in the bone, is an x-ray, okay? And that's what we typically look at and we first start all assessments with. But the definitive assessor and the one that gives the vastest amount of information is looking for some sort of compression. And at that point, sometimes we have to look at the arterial or venous circulation. But the number one way to determine if someone has a sciatica due to a disc injury or some sort of compression or a space-occupying lesion like a tumor or some sort of arthritis or some sort of imbalance in the muscle is truly the MRI. The MRI is a very good tool. Now, if there is bone involved, a CAT scan is used. The EMG is used to determine the muscular tone and the ability of the muscle to react and seeing which tone levels, but you don't need to be a rocket scientist and put someone through that. They already know that their muscles are tight and there has an issue. The the ability to determine how the nerve functions is a nerve conduction velocity test. That actually tells you how fast and how slow the nerves can work. Now, in the situation where we do a bone scan, we're trying to look for any sort of metabolic issues, okay, that are outside. And there could be a tumor or some sort of issue, but that's rare and that's not the typical. But the number one way to assess an issue is through an MRI and an X-ray. Those will give you the biggest, broadest areas. Now, I want to go ahead and talk about a little bit about the nutraceuticals, and specifically the nutraceuticals, and we're going to go ahead deep in this about the treatments for it. And as we go through that, I'd like to go ahead and discuss certain areas and certain supplements. Now, Astrid is our resident nutraceutical information gathering. We also have a biochemist in the background that's going to bring some insight to a different level. But what are the kind of things that we do typically to offer patients when they do need it as a metabolic alleviating protocol?
Okay, well, first of all, I just want to bring in an interesting statistic. According to researchers, approximately 80% of the population suffer from some type of back pain. Included in that is low back pain and sciatica. So with that being said, of course, it becomes a priority to know what is it that what can we do to assess this common problem. And like Kenna and Dr. Jimenez, like you and Trudy have said, exercise is very important. And together with exercise, we want to bring in diet. We want to bring in, we want to eat foods and supplements. And because obesity or excess weight is one of the problems, is one of the main causes, or one of the most commonly well-known causes of sciatica, we do want to, together with exercise and following like a good diet, we want to follow these things so that we can, if we lose weight, it can help improve sciatica. So with that in mind, there's several, I guess, natural remedies, natural nutraceuticals, if you will, that can help reduce or improve sciatica symptoms and therefore lose weight. So one of the ones that I want to talk about is we have it here is turmeric or curcumin. So turmeric is a plant. It's a flowering plant, and it's related to ginger. And we eat the root. That's what we know it. It's this yellow kind of orangey looking root that it's very commonly used in Asian foods and most commonly in curry. And curcumin, you'll hear turmeric and curcumin used interchangeably a lot together, and curcumin is actually the active ingredient that's found in turmeric. So one of the things that I wanted to bring up with turmeric and curcumin is the benefits. A lot of people can either eat turmeric or they can take turmeric supplements, and it can help reduce sciatica or sciatic nerve pain. So turmeric has a lot of anti-inflammatory properties, which can help reduce pain and swelling, which is probably one of the most common symptoms of sciatica. There's a lot of research studies which have actually found that turmeric or curcumin can reduce neuroinflammation, which is inflammation in the nerves, which as some of us here know, if your sciatica is caused by a disc herniation or a herniated disc, sometimes the substances or the chemicals that are inside of your disc, they can irritate the nerves. So taking turmeric and curcumin, it can help reduce the inflammation caused by these compounds, basically, that are irritating the nerves. Turmeric and curcumin also, it's a powerful antioxidant. It can help reduce oxidative stress, which can cause inflammation as well. And probably one of the most, one of the highlights of taking turmeric or curcumin is that it can actually improve metabolic syndrome, as we previously discussed in a past podcast, research studies have found that turmeric can help regulate body fat by reducing inflammation. It can also help reduce bad cholesterol. It can reduce triglycerides. It can improve blood sugar levels, and it actually has antibacterial properties as well.
Let me ask you. We're talking about the potential of someone having sciatica. Since some people have sciatica that kind of looms on them, what we're trying to do with turmeric is we're trying to prevent it from kicking off, right? So it's basically like a prophylactic prevention. I'd like to go a little bit deeper. We have our resident scientist here, which is Alexander, and he is right with us right now, and he's got some points of views on some of those supplementations. Tell us a little bit about what you've learned in terms of supplementation and your point of view on how we can assist sciatica from a biochemical point of view.
Well, there's a couple different ways of taking different perspectives in the approach to avoiding the whole inflammation response is a good way of saying it. Let me see. Can you guys see my screen here?
Yes, we see you. We see you right now. So I see your screen. Yes, I do. We see your screen completely.
Awesome. So I'm going to go into a little bit of the biomechanics of what's going on with sciatica, and then we're going to break down a little bit of the muscles, and then we'll go into the supplementation aspect of what we can do to have either prevention or a active treatment during treating sciatica. So here we can see we have 3 individuals from left to right. The first one is an individual who has a neutral spine, and you can see that as we draw a line down the middle, their external auditory meatus, which is their ear, is in line with their deltoid, and it is in line with the median part of the sacrum. On the second person, we can see that they do have a little bit of dysfunction in terms of their physical aspect. So here we have an individual whose sacral promontory, which is the anterior side of the sacrum, is tilted superiorly, and their posterior area is tilted inferiorly, I'm sorry. And what this is called counternutation. So by having that sacrum pointed up, you're putting more stress on the thoracic region and causing the areas to be more inclined to different stresses. And most of the time, this is actually caused by tight hamstrings. So these hamstrings are pulling down, forcing the anterior side to come up and stretching these quadriceps. So it can either do from an imbalance of over powerful hamstrings or tight hamstrings and weak quads. On the third individual, as we draw the same line down the middle, we could see that they are almost in line, but on an individual like this, we could see that their sacral promontory, the front side of the sacrum, is tilted anteriorly. And this is called nutation. So we have counternutation over here. I'm just going to put counter, and then nutation over here on the right side. So an easy way to remember this, it'll stick forever, is that this is pretty much, if you think plumber's butt, that's what it looks like. J-Lo, this is what J-Lo looks like.
Oh, wow.
So you'll never forget it that way. But the difference is that here the pressure is on the thoracic spine, but in an individual with nutated hips, the pressure is in the lower back. So let's say someone is pregnant and developing another child in this area, they're going to be putting more pressure on the lower back versus someone who has pressure on their thoracic area, they're going to be more pressure there. So kind of going into a little bit more of the anatomy, we can kind of see that we have all the different muscles here. And we can see that the piriformis is this muscle right here. I'm going to get a different color for you guys so you can see better. Is this muscle right here. And then we can see the superior gemellus is right under that. So sandwiched between the two is the sciatic nerve. And if we have someone who is nutated, they're going to be stretching these muscles more and putting more compression on that sciatic nerve, causing that area to be more inflamed. More of those neuropathies are occurring, shooting down the leg. And then another instance is when we have the piriformis, which is split in half, and the sciatic nerve is actually running between them. And that's 10% of the population that usually happens in. So, and these people have always had sciatic problems. So by strengthening and working on those conditions and going over those nutraceuticals that we're about to go into, we can treat and alleviate some of those symptoms. So the first one I kind of want to go into is a little bit of a niacin. So niacin, we all see it as the store brand, as something popping up like that. And most of the time it's either in 250 milligrams or 500 milligrams of capsules or tablets. I always recommend to get the tablets just because you can take half of the tablet. And I tell people this is because most of the time nicotinic acid is the main thing, as vitamin B3 causes a little bit of a flush effect, but that's just the way it works. So as we're going into it here, we can see that nicotinic acid, as it's going through its chemical pathway, actually produces lots of NAD+. And NAD+ is very important in the cellular metabolism of many tissues. So kind of going into brief biology, we all know that the mitochondria is the powerhouse of the cells. We're all beaten to death growing up in basic biologies. But as we take a look more in depth of the structure of the mitochondria, we can see that it has an outer membrane, an inner membrane, and then an intermembrane space. So we're going to take a look mainly at this little section here that's kind of folded in between, which are called cristae. And we can see that the first complex, complex 1, or also known as NADH dehydrogenase, is responsible for using NADH and converting it and using its protons and moving it across the gradient in order to make ATP. But we could see that more NAD plus is produced here, right? So that's where niacin comes into the effect. We supplement more with NAD plus in order to cause a reduction reaction between NADH and some other electrons, forcing it into NADH. So what does this all mean? Pretty much what we're doing is we're creating a boulder downhill effect. So we're putting more NAD and we're forcing it to go to product. Now, how does this happen? Really, just easy thermodynamics is you put a lot of it up the hill, the enzymes are going to force the work to go down the hill and make more NADH. So in doing so, you have more healthy metabolism of cells. And this does not only correlate to neuropathies, but it also helps with circulatory function, cardiovascular health. The main multinucleated muscle in the body is the heart. So you're not only making sure that your neuropathies are covered, but as well as you're making sure that you're keeping a healthy heart just by supplementing with vitamin B3. Another great one, this is just kind of saying that you have more ATP produced and you can have more functioning and healthy tissues, is green tea. I chose to use green tea because it has a very similar pathway to curcumin in the sense of anti-inflammatory effects. So the main ingredient in green tea, in case you either have green tea in your house or you have curcumin available, whichever one's easiest for you, they mostly have the same chemical pathways in the way that they inhibit either inflammation, cell proliferation, or neural damage. So the main chemical in green teas is called catechins. And catechins are similar to catecholamines, which are like epinephrine and norepinephrine, which is just adrenaline. And the main one is EGCG. And the cool part about EGCG is it actually inhibits NF-kappa B, and it inhibits ROS. ROS is just a reactive oxygen species, which is just free radicals, which can cause havoc and wreak havoc throughout your body, which hence is why it's a what's the word I'm looking for, antioxidant. So in doing so, it prevents NF-kappa B from producing any proliferating effects from cells or inflammation or neural damage. Now, if we kind of go more into the biochemistry, I'll kind of just break it down a little bit here. So EGCG, will actually upregulate AMP. High levels of AMP will downregulate this enzyme called adenylate cyclase and allow for ATP to be converted to CAMP. This is important because not only does CAMP break down things, but it mainly breaks down any adipose tissue, or as well as it helps kill any cells that are proliferating too quickly, such as cancerous cells, and it also keeps cells functioning properly, such as neural cells. So as we're coming in here, another cool part about green tea is it has small amounts of caffeine. If you are pregnant, we don't recommend that you do any caffeine or any stimulatory effects. Always consult with your doctor before taking any of these things. Specifically something that does have caffeine in it, we just don't want to mix anything, especially during pregnancy. But in the event that you are just trying to make sure that you help your sciatica or your metabolic syndrome, green tea has another effect using caffeine, which inhibits phosphodiesterases. And phosphodiesterases are responsible for turning off CAMP. So it's a double whammy effect. Not only are you burning fat and shutting down glucose storage, but you're also allowing for this catabolic, or this structure that breaks down things, to keep going. Here's a little bit of an overview of kind of just different things that green tea does and how it helps, and just kind of going into it. Another cool part about green tea is that it binds to other very toxic things such as iron. we know that we have iron in every red blood cell, but people who have hemochromatosis have too much iron in their blood, and they have to give blood about once a week. So someone who has hemochromatosis, I'm sorry, can take supplementation of green tea and be able to reduce their iron levels, preventing any toxicity from those iron.
You know, when you're talking about those pathway patterns, you remind me very clearly that many of the times the whole idea behind our show is to try to give you natural ways. However, there are powerful medications out there that work with these pathways. One of them, which is gabapentin, which is used for neuropathic pain. Many people don't want to do that because of the side effects and the critical issues that it causes. Having said that, we were looking at this in a natural format, in a natural way. Going back to the metabolics, what other things have you noticed in the metabolic areas that you have seen? What other supplements do you notice that have been able to assist people recover from? Because Astrid mentioned turmeric, and that's the line that we're using. We're using the anti-inflammatory, limiting the reactive oxygen species, or the ROSs, in order to prevent the inflammation from occurring. Is that correct? Excuse me.
Yes.
Okay.
So
Right.
the main thing is just to inhibit the production of NF-kappa B, which both curcumin, other known as turmeric, they both have the same name, they're interchangeable, as well as green tea, both inhibit these inflammatory pathways as well as cancer pathways.
Yes. So let me ask you, Astrid, in terms of those inflammatory comments, tell me a little bit about what your thoughts are on this particular method.
Well, I actually wanted to add another compound that is that can be beneficial towards sciatica or sciatic nerve pain, and that is also it's called alpha lipoic acid, so or ALA, and so ALA is it's an organic compound, and it is produced naturally in the body, but of course in smaller amounts, or it can be found in foods such as red meats, organ meats, or in plant foods such as broccoli, spinach, Brussels sprouts, and tomatoes. Or it can also be taken as a dietary supplement. And I actually wanted to discuss, I guess, the effects or the benefits of alpha lipoic acid, because just like green tea and turmeric or curcumin, ALA it also has it is also a powerful antioxidant. And it also helps reduce inflammation, according to several research studies. And it can also have a lot of benefits towards people with metabolic syndrome, because it can help lower blood sugar or blood glucose levels. It can improve insulin resistance, which is it's an effect, or it's something that can ultimately cause diabetes. And several research studies have also found that alpha lipoic acid can also improve nerve function, which people with sciatica or sciatic nerve pain, especially caused by neuroinflammation, ALA can also help improve nerve function in these people.
Okay, that's a very important point of view. As you can see here on our list, we have quite a few different presentations and different areas such as vitamin C, vitamin D, calcium, fish oils, omega-3s with EPA, berberine, glucosamine, chondroitin, alpha lipoic acid, acetyl-carnitine, ALC, ashwagandha, soluble fiber, vitamin E, green tea, turmeric. As you can tell, there's a lot of things that we can do to stop the inflammatory cascade. We're going to be going into all those because sciatica is so complex and so diverse that from the millions of presentations that it has, we have to find the best for the patient. So throughout the anatomy, as we discussed, and I'll show you back the anatomy in a second here, you can see that there's a lot of physiological and, as Alex presented, biomechanical imbalances that, if not taken into consideration, we will end up with issues in the future as a result of these predisposing dynamics. Now, as we cover these dynamics, we're going to be discussing a lot of different topics. So I wanted to at least give a little bit more on the side of the things that we do. Now, in terms of differential diagnosis, there's a lot of other issues that actually can cause these presentations, and from the dynamics of just a compressive nerve through space occupying dynamics, we have other areas that actually come in and affect the patient. So what we're going to do is, in the following seminars, we're going to go over specific types of things we can do. But let's give you some ideas in terms of the treatment protocols that are out there. We have chiropractic care, which is a form of chiropractic means the mobilization of joints and moving the body, and there's thousands of ways we can do that. A lot of people think that it's just manipulation or adjusting of the spine. No, we have to take a lot of things into consideration. We work on the bones, we work on the muscles, we work on the counter muscles. There's a lot of dynamics that we have to formulate to figure out what's best in line to assist each individual patient. Once we find out the cause and find out what we call etiology or the pathology and the problem, we can actually go and use different methods. We use acupuncture, nutraceuticals. We work hand in hand with different providers to provide medications. We also do ultimately, the goal in sciatica is to eliminate any chance of surgery. If there is a surgical need, well, that needs to be done. But that's such a small dynamics that we don't want to go there unless we have to. We have different other protocols and different methods of treatment, like dry needling. We do aggressive rehabilitation. Now, why are we doing rehabilitation? Because as you saw in the picture earlier, the muscles that we have were extremely involved in calibrating of the hips. Now, as we do that, we want to make sure that we determine. Now, over here, we got some basic care. We also got some aggressive care. Now, as you know, some basic care would be like ice, cold, ultrasound, TENS units, spinal adjustments, lifestyle changes, which is pretty much the biggest one, because most people end up in a chiropractic's office because their lifestyle has changed. Now, what do I have? I have a person who was an athlete at one point that suddenly got a desk job and now doesn't move as much. Well, that's easy. We can start getting that person back into yoga, Pilates, Tai Chi, getting their bodies to pelvically align and their whole body structure to get back to where it should be. Here's the deal. As soon as you can get past the inflammation and prevent that, and we can get you to move your body in a way that you did when you were a child, kind of like moving, dancing, and walking, that's the way to calibrate the glutes. This is a powerful muscle, and as we've learned through technology and science, is there immediate atrophy occurs when the muscle's not used. So imagine what happens when you start getting a job and you used to be an athlete, and now you sit down 8 hours a day. That's going to give some great dynamics. So one of the crazy components is as I kind of look at this, I kind of give you an idea of the kind of types of exercises that we can do. We can go into the extreme kind of CrossFit environment, and if we look at that, you just don't look at the crazy structures, but you're seeing people moving dynamically. There's a lot going on here, and a lot that you can actually see that we can come up with. Our rehab centers, we have extreme athletes to even the people that are able to move just a little bit. But the point is that as we do this process, we actually can help someone with the treatments and the protocols that are actually occurring. As you can see in this particular area, we can actually see Trudy, and this is one of the things reason I was alluding to, but we can actually see when you were actually doing some sort of self-treatment here. Tell me a little bit about what you were doing and what you were experiencing at that point.
That was, I believe, if I recall correctly, that was after my competition. I did compete for CrossFit, and obviously, after it's hard. It's for a couple of hours. It really takes a toll on your body. So I was kind of stretching my hip and stretching, the rest of my glute area to avoid that flare up again. That's something that once you experience it once and you have to go through the treatment, it really stays in the back of your head, because you certainly don't want to experience that pain again. That's why you have to pay attention to all the different preventive areas and approaches that you can avoid to ever having a flare up.
Well, I got to tell you that I led you there because I know you had a lot of experience with sciatica. Alex, let me ask you this. You were an aggressive competitor in the worlds that you did things. Tell me a little bit about the things that you did that you noticed when you were working, let's say, as a collegiate athlete. Did you ever have hip issues?
Only when I didn't stretch or when I didn't work on my core muscles or when I wasn't making sure that I was anatomically in line. I did have some issues either with joint pain or just lower back problems or even upper back problems. It all just tied into either flexibility or I just wasn't paying attention to either my diet as strictly as I should, especially at that level. So yes, I did.
Yeah, you know what? There's a lot to be covered here, and we're going to be discussing a lot of issues. Did anyone want to add something else before we kind of close out? I want to thank my crew for what we've done here. We're going to continue with this story of sciatica because we're going to go real deep. We're going to get nasty with the information. This was a beginning of kind of touching on the subject matter. I want to thank you, Alex, for bringing the information because extremely very deep in terms of. I want to thank Steve for giving us the insights as to the biochemistry. My true patient over here, Trudy, and my coach over here, Kenna, and the supporting staff. So what I want to also go, if you guys want to find us, we're here in this area. We're here available if we can help you, and you can contact us at any given time. I want to thank you all, and I appreciate it. And we're going to be hitting sciatica relentlessly because it is relentlessly the scourge. It is ripping apart a lot of people at their works. They just quietly suffer. They don't sleep. They stress out, and it really causes a disruption. And if it happens in mommies, well, then it disrupts the whole family directly because a happy mommy is a happy family. So the whole thing is what we want to do is we want to assess exactly what's going on here, find out the treatment protocols, and give you the best options as possible. Thank you guys very much, and God bless.